Okay, hi. So my name's Nick O'Shea, and today we're looking at the economics of public service provision. There are 6 chapters. Here's number 1. This is about savings. Now, all savings are not created equally. There are 4 types of savings, and this is how they work. The first is cash savings. That is literally, I went and got something cheaper, and here's the cash for it. So a great example in the NHS is I got some medication, we found a different supplier, and we got the price to fall. The end result is that your budget is now bigger because you've got more of this. The second is redistributive savings, which is essentially where you queue shorten. The idea here is, for example, with you reduce ambulance call-outs. Now what that means is you don't actually make any cash from that, but you do reduce the waiting times of other people so they get seen quicker. So that's redistribution. Thirdly, you've got block savings. Now, the example I'll give you here is you've got a prison. If you stop 50 people going to prison, that's great, there is a saving, but you can't actually monetize it. Stop 5,000 people going to prison and you can shut that prison, and that's where you can extract the money. And then finally, in the long term, it's famously said that we are all dead, and sedentary savings are just that. This is the idea that actually in the long term, if you leave it long enough, you can actually extract the money from the system. So this is like wholesale change of the social security system. That's a sedentary saving. So finally, just one practical example, we're looking at mental health care in primary healthcare settings. The idea here is that you offer someone a new service, and that stops them from using the GP surgery as much as they would do normally. Where you make the saving, though, is not in terms of the fewer appointments for those people. It's actually the ability for the doctor to say, I now see people on average less, so I can take on more patients. And there's therefore a saving to me per patient, which I can monetize by taking on more. So that, in short, is chapter 1, and that is savings.